அந்த மாதிரி ஒரு இதே வரலையா இல்லை அது ஒன்றும் பெரிய ப்ராப்ளம் கிடையாது. இது ஒரு நிமிஷம் சரி இது ஒரு நிமிஷம் வீடியோ இதுல ஒரு கேமரா மாற்ற மாதிரி இருக்குப்பா, ஆட்டோமேட்டிக்கா இந்த கேமரா போயிடுச்சு.
அந்த கிளார் அடிக்கும்
மேனேஜ் ஏன் வரல? இல்லப்பா, இதுல ஆக்சுவலா ஒரு சிம்பிள் இது இருக்கு, அது எனக்கு வந்து இப்போ பண்ண முடியாது. இல்ல காமிக்குது யாரெல்லாம் இருக்காங்க வர. சரிப்பா திருப்பலாம். ஆனா மைக்கு அந்த மைக் இருக்கு, அது செட் ஆகுமா? அது எந்த பின் சார்? இல்லை இதுல பின் வந்துருக்கு, அது எல்லாரும் போகும். இல்லையா சார், லூஸா இருக்கு சார். இதுவா இதுவா okay, we made some mistakes, so we are slightly late, but anyway, இதுப்பா இங்க இருக்கு சார், ரூம்ல பக்கத்து நீங்க So what we are going to do is relatively simple idea. We are going to learn to think today rather than understanding anything super new or something like that. But when you learn to think, things become different. It cannot be the same if you are thinking in a different manner. Right? So these are based on biases. There are probably 50 or something like biases. But we are going to talk about a few important biases, right, which influences our performance. Right? Now, we are going to start with simple mathematics. Don't be worried about I'm going to ask you anything extraordinarily difficult algebra or something like that. So these are the three questions, right? I'll give you 2 minutes to answer it. As I told you, that's not algebra or anything like that, right? And please remember, you can just have a simple mathematics. It's not a complicated. Otherwise, they all have the same one. Simple question, right? So if you're unclear with it, you talk with the third question, right? So it takes 48 days to cover the whole lake. Whereas if you have lotus, it takes 30 days. 48 days. And each day the patch doubles, right? So each day the patch doubles. So when the lake has to be half filled, what is the how many days it will take? That's the last question. The second question is, it takes 5 missions, 5 minutes to make five something, right? Just or something like that. How long it will take for 100 missions? Right? That's the second question. And the third question, mostly everybody gets it wrong. There's a back and a ball cost 110. What will be the cost of that is $1 more than the home. So what's the cost of the dollar? Right? So these are the three questions, right? So anybody wants to answer starting from the problem?
First one, 5 cents and $1.
Okay, 5 cents and $1. Okay.
$1, 5 cents.
Okay, $1 and 5 cents. Okay.
Second one, 5 minutes.
5 minutes. Okay.
Third one, 47.
Third one is what's third? How many of you got the answer? What he got? None of us, right? Alright? Actually, what? It's not being smart or anything like that. That's how our mind works, right? If it doubles in 1 day, 47th day will be the half of the pool would have been filled, right? In the next day, it would have been 48, right? But we will always say the answer is 24 or something like that. That's what we're all saying, right? This is what happens to us all the time. This is a book called as Nash. It's in behavioral economics. They also say that similar thing happens to everybody, right? So we are trying to use this idea of this way of skewed thinking, mostly which happens to us, and how to think in a like nobody gets this right that fast. Right, so what I'm going to do is they are going to use similar questions like what I have put like right? Rather than having a mathematical question, what you're going to have is you're going to have pathology questions, etiology questions, and we are going to think fast and we are going to think slow, right? So that what happens is if you think very, very fast, what happens is you come up with the answer which is dissimilar to what we said, right? I want to get to that. But anyway, so whenever we are thinking of anything, right? Whatever pops in your mind is based on prior knowledge. Nobody comes with newer knowledge. You cannot think like that ever. But you always think which is already been given, right? And the knowledge which we have will always be probably wrong and right. Right? We'll have things which are right as well as things which are wrong. ரெண்டு சேர்ந்தா இருக்கு எல்லாரும் வந்து அப்படியே என்னோட நாலேஜ் எல்லாம் கரெக்டான நாலேஜ் யாரும் find that, right? And because our knowledge is skewed like that, And when we try to retrieve the knowledge which is already existing, we make a lot of mistakes. Even if it is good knowledge or the right knowledge, we cannot retrieve it properly. Because we are being constrained by evolution. Right? How we think is constrained by evolution. Because we are all human beings, we can think only in a particular manner. When we are thinking very, very fast. Right? When we are thinking slower, when we are doing an analytical thinking, then we will think in a more clearer manner, in a more better manner. Right? So when we are thinking faster, most of the time we will have a lot of biases. Biases means that things which we are, which influence your thinking. Right? Say for example, there is simple biases between us in this group, gender bias, right? How the girls think and how the boys think. Right? The boys think only one thing about all the time, nothing else. Right? The girls think of hundreds of things, but nothing else, right? So everybody has their own biases all the time. This happens in medicine also, right? Now, one of these stories, I love to say stories, so you have to bear with me. One of the important stories you will see is, I'm going to ask again this question. I'm going to ask you two questions like this. I'm going to ask questions. So the first question is regarding etiology and pathology. What is the etiology of ulcers? Stomach ulcers, peptic ulcers. Right, that's the first question. The second question is, what is the function of supraspinatus? Right? Okay. Now we will not start with it. We will start with people who have finished medicine, I suppose. So what is the etiology of ulcer, peptic ulcers? Stress. How many of you think stress? You can raise your hand. You have to raise for something. You can't be like, right? They have to raise for something. How many of you think stress? Right. If you are not saying stress, what else do you think? Bacterial infection. Who thinks it's a bacterial infection? Very good. Right. Right, sir? Now, we all know that it is stress, right? We all know it is stress. The whole world knows that it is stress. But there are two, one pathologist and general practitioner from Australia. They found out that it was a bacterial infection. Right? You know how many years it took them to get a Nobel Prize from their first discovery? 7? No, 20 years. Several, okay. It took them really 20 years to get Nobel Prize. What I mean by that is, it took them so much of time to get recognized that they have found out to recognize that it's a bacterial infection. That is, the peptic ulcers or bacterial infection. What was the thinking that no, it cannot be a bacterial infection? What pops in your mind when I say bacterial infection in stomach? Why cannot be a bacterial infection? What is in your stomach? Acids. Can bacteria grow in acid? It doesn't feel like that, right? It doesn't. You cannot fathom that there will be bacteria in stomach acid. I can actually throw your stomach acid on your face and you can get burned. Right? So people were like reflexively they think, no, it cannot be a bacteria. Right? So that's how we were all biased. Thinking that it cannot be. Right? So the next question is, what's the function of supraspinatus? Initiation of shoulder ablation. எதுக்காக கை தூக்கணும் பாருங்க வந்ததுக்கு
Shoulder stability.
ரைட்
Shoulder stability.
அப்படிலாம் ஃபங்க்ஷன் கிடையாது it can be only it's a muscle it has to move so stabilization is not a function it's a part and parcel of any muscle will stabilize all the joint why else is there is a muscle right it has to stabilize something right so the first question I'm going to ask you is how does it stop after 15 degrees it's a muscle right how does it know it's 15 degrees no I will not work after that we never asked that question right when somebody told us it's a social when it's a starter of abduction we all write that again and again. We have been writing that again and again. You know when they found out that it is for abduction from 0 to 90 degrees or something like that in the 60s. Right? That is before I started studying anatomy. They found out that it's abductor. It is not an initiate. But it's not seeping in again into our curriculum. Because why? You can guess something, right? It's not correct answer. You just guess why it's not where we are always having a skewed way of thinking.
Wouldn't change our prayer. We are not comfortable changing our prayer.
As I told you, all our knowledge is prior knowledge. Right? And now, no, what I have told you, it's your mistake, not yours. No, you can blame me, right? So it's a cyclic process. Now, this is how these are two simple examples where our prior knowledge influences our way of thinking. Right? We all are not asking that one particular question. That is really, right? Can bacteria grow in acid? Or really, how can it stop at 15 degrees? Right? We didn't ask that question. Now I'm going to, this is what I'm going to talk today about, what we call as a paradigm. Paradigm by definition means a model, right? A pattern is the word. If we think in a particular way, that's what we call it as a paradigm. Within that particular model, we think, right? And paradigm shifts are very, very difficult. From one way of thinking, one model to another model. It is very difficult. Because when we start thinking in one particular way, it seems that whatever we think will all come into that model itself. We will try to put it in more and more information into that model, making it more solid and difficult to think away from that particular model. Right? So we are going to talk about paradigm shift in medicine as such, but mostly related to physiotherapy. Now, again, I'm assuming you are all aware of what is written here. The first one is, this is just for, I'm going to read that because who online may not be able to see it. The first thing is, the varanda leads to OAE, varanda leads to low back pain. There are some mystery points in the muscles which lead to pain. You can call that mystery point as mystery point in acupuncture, or if you are studying from a barber, then you call it as trigger point. The next is spasticity leads to difficulty in movement of your hand or movement of your leg and things like that. But we all know this is our paradigm. இப்படிதான் படிச்சிருக்காங்க இல்லையா? சில பேர் படிச்சிருப்பீங்க. So that's how I studied, right? There's no two ways about it. This is how I studied. I still believe that also. So, if we are going to shift from this way of thinking, right? The first thing we want to know is, do we want to shift? Whether this paradigm has any difficulties or is it unable to give us a complete picture. The next question is, okay, if I'm shifting, where am I shifting towards? Right? I should have some other way of thinking. இது தப்புன்னு சொல்லிட்டு விட்டுட்டோம்னா பொதுவா யாருக்கும் வந்து என்ன பண்றதுன்னு தெரிய மாட்டேங்குது. Yeah? So now in all these things there is one thing which is common to all these things. One commonality. It's difficult to say that because it's nothing explicit. It's just that one thing leads to A leads to B. There's nothing else. That's what I meant in that picture. There is just one person fights with another person and he punches and goes away. Like a simple machine. Cycle ஓட்டு போறீங்க பஞ்சர் ஆயிடுச்சு அப்படின்னா உடனே ஒண்ணுதான் காரணம் இல்லையா இதெல்லாம் ஏதோ குத்திச்சு பஞ்சர். So one reason leads to another. Right? This is what we call it as a simple machine. Am I understood? A simple machine is okay. Switch போட்டீங்க லைட் எரியல ஒன்னு பல்பு போயிருக்கணும் ரெட் ஷார்ட் போயிருக்கணும் இல்லாட்டி வயர் போயிருக்கணும். So yeah, simple machines are easier to do. This is how all our thinking is in medicine. Am I clear? Right? So, what do? We clinical decision making is based on that particular simple thinking, right? So, for all patients with Varanta, the first and foremost thing we do is we take an X-ray to find out whether there's a Varanta. Okay, that is the method of finding out. If it is spasticity, there are 100 ways of treating spasticity and 100 ways of assessing spasticity. Okay? So, we grade them using the X-rays as in case of OAD. We come up with so much of diagnostic criteria in case of low back pain. When I studied, we used to have 6 or 7 low back pain patients. When I studied, there used to be a physiatrist who was in OPD and he would send our patients, right? So he will write lumbago. That is not used nowadays. That's a common terminology they used to have. It's considered as a sort of an Anglo-Indian terminology. Lumbar spondylosis, spondylolisthesis, sacroiliac strain. What else? Lumbosacral strain. That's what I meant by that. Then sciatica and okay, what not? Right now, or multiple strain. That's also really useful. Whenever I saw that, I always thought that my physiatrist has so much of knowledge, he's able to differentiate all these things. That's what I thought. I didn't think, how did he differentiate? How do I, is he wrong? Right? I thought that I should also learn to differentiate these things. Am I understood? I thought that I was unable to read the X-ray, so I was unable to differentiate between lumbosacral strain and lumbar spondylolisthesis. Clear? That's what I'm assuming. That's how everybody thought, right? So, one of the reasons why we take an X-ray is we want to find the exact reason for back pain. Right? Valvare solli poittaru. Enna solli poittaru? No nadi? Right. So you have to find the exact reason and bring Harvard solli poittaru. Right? So we are trying to find the exact reason. Right? For back pain. Right? If you ask anybody, any patient, even therapists, they all want an X-ray. They all want an MRI. Why? Because they want to know the reason for your back pain. These are all evolutionary reasons for that. If you know the reason, what it will help you in? Patient கட்டாயம் அவங்களுக்கு ஏன் வந்து தெரியணும். கரெக்ட் பண்றது நம்ம வேலை இல்லையா, அவங்களோட வேலை இருக்கு. They are not going to correct by themselves. They are coming to you. No, treatment, that's why they are coming to us. So they are assuming that if we know the right reason, we will treat it. But they also are telling me what's the correct reason, right? Why am I getting this? Why am I getting this? People will always ask you all these things.
Information.
Communicate with you. Sorry?
Relatives.
No.
Only other reason, sir.
That's a good point. But that also has that's also part and parcel of why they are doing that. Is because if you know the reason, you can prevent it. Right? நாளைக்கு வராம பார்த்து. So one of the common reasons a lot of our people think back pain is because we eat too much of potatoes. And somehow or other, the body has so much of space in it, and the body is going to go and rent our place without renting, giving us rent, and it goes away when you eat ginger oats. Right? This is just as I told you from our prior knowledge 2000 years back. It's not today's knowledge, right? It's been passed on to us for eating carbohydrates, and you will need to boil. But we are not worried about rice because rice is made up of honey and right? We are not worried about other things. But anyway, so everybody wants to have this innate reason to know why I am getting this, because so that I can prevent it the next time, right? So that I will not do it, so that I will stop it, right? எப்படி எழுதுங்க அப்படின்னு கேட்கறது நம்ம ஒரு முக்கியமான ஒரு கேள்வி நம்ம. If somebody is in accident, you will be asked, how did he fall? வந்துட்டாங்க என்ன பண்ணணும்? Why is that information very important? Is because we think that probably it will also be a lesson for me, right? நான் வந்துச்சுங்க அந்த நேரம் okay, so I have to be careful about dogs. Most important reason everybody gets in an accident is because the dogs are inside, right? One of the things you have to do if the dog comes in is just keep on driving, because the dogs have a better reflex than you, right? If you put a brake, you are done, right? And you might injure your head and you might get all sorts of disease, but it's enough. So how do I differentiate all these things? The first thing you want to know is each of it should have a different pathology, and I should be able to get that pathology or infer that pathology. Now, the problem with all these things is they're all very similar, right? And most of it is inferred from an X-ray, right? Now, the first problem in this paradigm, that is, you see an X-ray and find out the reason for your back pain or pain, right? That was the paradigm for probably for the last 50 years, right? So if you want to see what is wrong with this paradigm, the first thing you notice is the imaging and the symptoms are poorly correlated, right? That means that most of you are in the 20s, probably slightly older. Other than that, if you take an MRI for people here, right? Most of you are in the 20s, right? At least one of your disc will be collapsed, right? There is no question about it. That doesn't mean that you are all having a disc prolapse, but that's what you will get a diagnosis if you go and get an MRI, right? Or X-ray. that means that it is poorly correlated. But there's a caveat to this. In case of OAE, again they are poorly correlated, but if it is very severe, the X-ray and your clinical features might be correlated. That is, if the bone and bone are touching, right, nearly touching, then your severity of the condition may also be similar. Right? So what it does is you can't make up your mind with that needs to be with the MRI. So there seems to be a need for changing our paradigm. The next thing is, this is the most important thing. This is what a lot of people forget for a diagnostic test. When should we do a diagnostic test? What is the most important criteria for doing a diagnostic test? Any test, any examination, whether it's physical or whatever. What is the value of, what are the rules of having a diagnostic test, principles? Another mathematical. What should it change to have a diagnostic test? It should change your treatment and outcome. If it is not changing your treatment or outcome, then the test is as good as nothing. Am I understood? Right? So if you take an MRI and treat a patient with low back pain, and if you don't take a patient MRI and then treat a patient with low back pain, it should be different. Am I understood? Check. You are going to OA, you are having OA and you are going. If you are going to orthopedic, right, or a GP with OA, what is the treatment?
The sides.
Painkillers, right? NSAIDs or whatever it is. X-ray NSAID. X-ray is other NSAID, right? So it doesn't matter whether we have this X-ray or not, right? If in the previous slide, when I went to college, we had so many different types of diagnoses, right? But we all had the same treatment for each one of the patients, right? When we went to college, we didn't have IFT, so there was no IFT in our. I learned to do IFT when Saravanan taught me in 2016. So until that, I didn't know how to do an IFT. So we had shortwave and extension axis. That's what now also it's happening, right? Same thing, right?